Hi, this is Dr. Jenny Byrne. I'm an adult psychiatrist at Cognitive Psychiatry of Chapel Hill, and today I'm going to take a few minutes and talk about what it's like for adults who have ADHD. So ADHD is attention deficit hyperactivity disorder. Some people talk about ADD, attention deficit disorder. They're really the same thing. ADHD is the proper kind of diagnostic term. So we know a lot about ADHD in kids. That's been a diagnosis that's been around for a while, but until recently we didn't really think about adults as having ADHD. But the more we research it, it seems like many children who have ADHD continue to have it as an adult. And there's some debate actually whether there's an adult onset ADHD where people don't have it as children, but they get it as an adult. So that's a little bit debated. But in any case, the symptoms of ADHD in adults look different than they do in kids. In kids, you might have a hyperactive, impulsive kid, and this is, kind of the classic ADHD kid who's bouncing off the walls, can't sit still, fidgeting, talking a mile a minute, distracting everybody in class. Or you can have an inattentive kid who's more of maybe a daydreamer, kind of seems spacey, like they're not paying attention. So in adults, you don't typically see people bouncing off the walls because they've learned how to deal with that and they know it's not socially acceptable. However, they do tend to have a sense of internal restlessness where they can't get comfortable, they feel like they got to keep moving, but it doesn't always look like hyperactivity on the surface. They can also have a lot of symptoms of impulsivity, but again, where a kid might be yelling or blurting things out or throwing things, an adult is going to have impulsivity that shows up in other areas, like, for example, interrupting people or driving too fast or spending too much. Sometimes they can have impulsive relationships. It doesn't tend to look the way it does in kids. Then you get those inattentive symptoms, where in kids you get kind of daydreamy. In adults, this can seem like they're not listening to you, like they're not able to focus on what they're doing. They're easily distracted. They jump around from one thing to the next, trouble to get started. Some adults have poor time management skills, where they're always late, and there's some evidence that adults with ADHD actually have a different sense of time, that they perceive time a little differently than people without ADHD. So that's kind of interesting. Sleep is a big one in both adults and kids. In adults, what you might see is that their circadian rhythm is shifted forward a couple hours. They have real trouble falling asleep early. They tend to be night owls, stay up too late. And that leads to problems because when you're an adult and you have a job, you got to wake up in the morning and go to work. And if you didn't go to sleep until 3 in the morning, you're not going to be very well rested. So sleep is something where you see it a lot. Adult ADHD is, I think, underestimated in how severe it can be for people. If it's untreated into adulthood, what you can see are a lot of problems that go along with it. Substance abuse is a big one. Up to 30% of people with ADHD can develop substance abuse. Maybe they're self-medicating symptoms. Maybe they're impulsive, and that leads to substance abuse. But that's a real common problem. Depression, anxiety are also really common in adults with ADHD that's not been well treated. So there's a lot of problems that can accumulate with adult ADHD over the years. So this is just a quick little blurb on some of the symptoms that you see in adults. There's a lot of good books out there. A very good lay book for you to read if you're just curious is Driven to Distraction. That's written by a doctor who has ADHD. I think that's a great kind of introduction to what it's like for adults who live with ADHD, but there are a lot of other good books too. So I hope this was helpful. If you have any questions, if you think you might have adult ADHD or someone you love and you're not sure what to do next, we're happy to help. Please just contact us at the information below. Thank you. Bye-bye.